Hey, good evening and welcome to your favorite show, Ask Dr. Saw. Today we're privileged to have Dr. Saw in studio again. I don't know for how long he's going to be here, but we have him here in studio, and we're going to continue our discussion from last week on general health topics. This evening, Doc is going to share some of his insights on some things that that I want to ask him about healthcare and healthcare facilities in Guyana. But Doc, good evening again and welcome. We're happy to have you here. I know next week you're gone from we again.
Temporarily, as I say, I'm up and about, and this weekend it was quite hectic. I was over in Esquivel.
Yeah. I was supposed to make that trip with you.
Yes, indeed. But it was lovely. I mean, I like all parts of Guyana. I'm originally from Barbados.
Right.
Grew up in Georgetown most of my, youth. And then marry in Esquivel, and then I end up liking there. I go there quite often. So it's good. And good to be back. And I think last week we didn't get to talk a lot. I mean, the time runs out so fast. Half an hour is just so fast we can't finish everything. I'm a bit hoarse tonight.
That's
just because it was the black water, I think.
Right. You had some lava curry too.
Absolutely. So excuse me for my voice.
No wonder when you after you married in Esquivel and she gave you black water drink from Esquivel, that's why you don't even go to Barbados anymore. But we talk about standardizing healthcare, and let's talk about standardizing healthcare in disease. And how do we, when you talk about standardizing healthcare from a European perspective, because you've been working in England for a very long time, Sure. What are we talking about, Doc?
So I spoke the last time when we talked about we want to have a level, a playing field where everyone gets at least some standardized or some basic care that is in keeping with good health outcomes. Mm-hmm. And I made reference to, like, if you say you have diabetes and one doctor might treat you and say you're controlled, and I might say, no, I'm sorry, that is not what is defined as control, then I have to give you what I think. Now, because like anything else, everybody get different ways of doing things, but what we want the same outcome. We want to have less stroke, less heart attack. We want you to have less disability from your illness. So if you have a different standard, I have a different standard, how do we know they all would lead to the same thing? So we use a bit of science, and studies have shown that if I have your blood pressure this level, you have less stroke and heart attack. If I have your cholesterol at this level, we have less stroke and heart attack. And that is what we mean by standardized. It doesn't mean that you can't be better, but you should have a minimum standard. So everyone would say, your cholesterol might be 5, let's say, well, in UK terms, we talk about 5, but let's say 200. in the Guyanese term. Your one might be somebody might say 250 is okay. I might say, no, I want it less than 200. Some would say, no, I want it less than 150. So these are, but the evidence tell us if you're less than 200, that is, you have better well, lower than 200, so it could be 150, it could be 170, 200, you have better outcomes. But if it's over 200, you have worse outcomes. And that is what is standardization in terms of the disease of itself. But there are other ways of standardizing care. We should have different the facilities that are providing the care.
Well, I want to ask you about something when it comes to standardization here. And remember, viewers, you can send in your question to us. If you send in your question to us, we're going to answer those questions next week in our next broadcast. This show comes to you every Tuesday evening at 8 o'clock, right here on this platform, on my page also, Akash Prasad, and you can find it on Dr. Saw's place also, his page, Dave Saw. Doc, I want to, I mean, I hope I don't raise a controversy by asking this, but here's what I've heard from people lots of times. They would go to the health facilities like the Georgetown Hospital, the regional health facilities, the public health facilities, and then they will get a diagnosis and they say, man, look, let me go for a second opinion.
Yep.
Right? No, here's what happened now. The doctor at the Georgetown Hospital or one of the government facilities give you a document saying this is what it is. You go for a second opinion, you go to a private hospital, you end up taking out 3 kidneys that you never got. I'm sorry to say that, right? But the standardization seems to go out, and I said I don't want to get in trouble here and create a controversy, but the standardization seems to go out when money is involved in some cases in healthcare. And what is this? How do we then use standardized practices to hold people accountable for one thing, not for just the care that they're providing, but also accountable for the money they're charging people for? Let me tell you something. I have had this experience, Doc. The moment I tell the man say we're gonna have money, man say, okay, you gotta go to Georgetown Hospital now.
Yeah, I mean, economics is a reality of life in terms of what we can afford, what we can't afford, right?
Right.
However, when it comes to we have free health care at the point of delivery, that is, in Guyana. Mm-hmm. Like the UK, we have similar system. So it is a fact that, of course, because you're providing healthcare to the population at large, it's a big chunk of people with limited resources. So your level or the access, the easy access, and what I would say, the individualized care might not be at your calling at every time. So lots of people, they have money and they can pay and have it done elsewhere. To suit them. That is, okay, if you go to the hospital system, you may have to join a line. You queue up to get the service, whereas you could pay and say, hey, I don't want to queue up. I want to pay a guy where I can walk in, I have an appointment, I get seen, and all of that. That's all your convenience, and then you can pay for that. So that is acceptable all over the world. What is not acceptable is that a facility give you this level of care and another facility give you this level of care for the same condition. That can be accessible.
Right.
We have enough evidence, and again, we talk about the data, the science, the evidence. If I say the way to treat your kidney disease is to give you medication, that should be the standard because the science tells us that's the way. Mm-hmm. I shouldn't go to another facility and they say, you know what? I need to remove your kidney, and that's the best way to treat it. That should not happen. I mean, I just make
yes, of course,
your example.
Yeah, I was being a bit extreme. You're
that's
right?
Correct. Yeah. But the point I'm saying, so we want a system that you are held accountable for your actions. Now, we can do it in many ways. I mean, we have a code of conduct, ethical code of conduct. Mm-hmm. And the regulatory bodies like the Medical Council, Ghana Medical Council, and in the UK, similar medical council we have. And they give you guidelines, but these guidelines are not guidelines, they're not law. Some parts of it are law, but some parts of it, like if you say, Akash, doc, have this $100 and treat me better. I shouldn't do that. I don't need $100 to treat you better. The treatment is only one thing, right. One way.
Yes.
The money should not dictate how I treat you. So that is an important thing. The money can determine if you want me to leave my house at midnight to see you.
Right.
I can say, yes, you
That
have to
type of
pay me
service.
that type of service.
Yes, I agree.
And what we have, so the accountability here in terms of private services, the government service should be, streamlined, and I think that is open to the public, and is, we all have knowledge about how to access that, and we know that there's no fee to that. Sorry about that.
No, that's all right.
But in terms of the private institutions or private doctors, we should have ways of saying, this is a way to treat that. If we are providing a fee for service, the fee should be standardized. You need a blood test. This is a cost for the blood test. Our consultation is this. And these are all ethical things, right?
Right.
Good practice, because I tell you what, the worst thing you could do is in someone in the most time of need, the most vulnerable point in their life.
Exploit them.
Yeah, if somebody were to say to you, listen, you're gonna die, and whatever, and I said you have to give me $1 million, or to save your life, you'll say, Doc, I'll give you $10 million.
That's right.
Do it 100 times over and better. So people are at that stage when they're ill, because illness generally life and death issues sometimes. So you tend to, you're vulnerable.
Yeah.
And if we're not disciplined enough, if we are not morally, practicing good healthcare, good medicine, we hold ourselves accountable, we can get carried away. People can get carried away for different reasons. All our, our needs and our expectations are all different. So these are guidelines we should have. Now, my thing in the I'm just trying to compare systems, and not compare it in a way to say one is bad or good. It's how we can improve. Because if I compare two things, and one is delivering a better service, I would want to emulate that.
Absolutely.
And that's the intention. So I think we should, tap on all these different ways of doing things. And we don't have to reinvent the wheel, as they say. We copy somebody else if they're doing it right. So we have something called the Care Quality Commission. And the Care Quality Commission is a body that inspect health institutions. So you want to open a clinic to start seeing patients, you should have a prior approval to do that.
Okay.
A body now, this is made up of health professionals, laymen, and other community, you have a group, a mixed group. So it's not that you could say, fine, there's favoritism in this. But this should be legal. So you can't just go and open a private clinic and say, right, I'll start seeing patients. One, I have to ensure that your credentials are right. The medical council will give you that credential to say you've got a license. But you can't go into a untidy environment and put up a clinic.
Doctor's clinic here.
A doctor's clinic, and when you walk in there is contamination everywhere, the floor is dirty, there is dust everywhere, risk of infection is high, there is hazard to get into the building. You can't do that. That by itself, I can do more harm than good. So the Care Quality Commission will come around. You'll make an application to say, I would like to open a clinic. This is the premises. I'll tell you, these are the things you have to satisfy. I'd have to do a CRB, let's a criminal check on you. So what we call like a police clearance. Now that is important.
Yes.
Each doctor everyone should have that in this country if you're dealing with vulnerable children, people, anybody. So I want to know that you don't have any criminal. And we are looking more at safeguarding issues, right?
You're right.
I should ensure that your credentials are up on speed, so your registration is up to date, because you can be debarred and still end up opening a clinic. Then would ensure that your facilities are fine. The place you're going to practice, it reach some basic standard. The hygiene is good. You have some protocol you'll publish. How do you treat your staff? How do you have complaint, whistleblowing? If somebody sees a patient, you have sexual abuse happening and funneling, and people do that. Doctors are accused of that many times. And this goes across all over the world.
Yeah, universal.
And if your receptionist is there and a patient come out and say, no, the doctor was inappropriately examining me, and she wants to squeal, I should have a policy on she should not be victimized for squealing.
Okay.
Do we call it whistleblowing?
Right, right.
You see, I come into work drunk. You should have an obligation by law. You have an obligation to report this doctor seeing patients drunk. You should see your colleagues see you drunk and operating on patients. And these things happen. And I'm saying that, I mean, I know in the days in Guyana, we've heard of situations where doctors are drunk and they're seeing patients.
The man said, if the man and drink, he can't do that.
Yeah. No, those are illegal things.
Yes, yes.
Totally illegal. But I'm saying that we have to create, now eyes are on us. We've got resources. Gone are the days where we are impoverished and, we don't know, there are no check and balances. No, now we're aiming there. Even if we come up halfway, we have raised our standards.
Right, right.
So these are the things, and I think we should have those facilities. So that's one. Two, if I see 100 patients and 8 of them a month after they're all dead, am I a good doctor? And my friend next door is seeing 100 and 90 of them are alive, 10 die, and I get 80% mortality. That's a cause of concern.
Right.
So that is where the standards come into play. So I'm doing something wrong. Or if I'm a surgeon and operating, and the data shows that for every 10 patients I operate on, 5 have got complications or patients get bad outcome, I will come to a committee of experts now and say, okay, it's not a case where you would just go and knock somebody off. You'll come and say, let us see what went wrong. It could be that you didn't have the supporting services. It could be that you are not properly trained. It could be that your facilities are bad. The machine that you're using is malfunctioning. So when I'm reading your blood work or your blood pressure, my machine is okay, saying it's fine, but the readings are wrong. So this is where the commission comes into play, where we do inspection and we do calibration. Your equipment got to be calibrated. There are facilities where you're doing blood facilities, you're doing all of this, your blood tests, and your machines are not, you got one result here and another result to the next door. Those are not, those are things we got to remedy.
Yeah.
So that is where I think that it's important for us to standardize care, both at the human level and institutional level.
There are certain aspects of that Guyana is growing. This country is expanding rapidly. I know you see what's happening there. A new road was commissioned last night.
Yes.
They have all of these highways and so on. We've been having a lot of accidents. Now a lot of these accidents seem to have been involved. The man said truck driver, they got to bring these truck drivers. Now when you look at the truck drivers, they got a lot of truck drivers, very, very young people, because there's a high demand for them, right? And some of them are old also. Some of them have been driving truck for long. So if you could get a job yourself in a job. Now, should there be a I'm just asking, should there be like a standardized test for drivers, especially if these vehicles will be driving long hours, late nights? Because could bad health impair their judgment? Not just impair their judgment, but impair their driving in such a way that cars kill people. 100%.
That is a known fact. So, for instance, I remember one time. So two things we have to have. So, what do we have? You have what we call Group 1 license and a Group 2 license, driving license, right? If I'm doing commercial vehicle, passenger vehicle, and big heavy-duty vehicle, that's a Group 2 license. The requirements are different, and for you to get that license is different from a private car license. So that's the first thing we need to establish. So because if you got to transport 100 people in a big bus, you're responsible for 100 people's lives.
Right.
You got a big vehicle that can ram into a crowd and kill 1,000 people versus a car. So these are all factors, right? So you should have different criteria. Now, I remember doing a medical. So we do medical for heavy-duty vehicles, Group 2 license. That is taxis, minibus, and lorries, right?
Okay.
And a guy came from abroad and he wanted a license, and I said, fine.
This is in England, right?
In England.
Right.
And I asked him a couple of, because he's new. I don't have his medical history. So everyone that born in England or live in England, they would have a doctor they're registered to. So I have your medical records.
Right.
So if you come from abroad, I don't have any medical records. So I asked him a couple of questions. Are you good? Past medical history? Nothing. Do you have anything wrong with you? He said, no, nothing's wrong with him. I said, this is an easy one. I said, okay, let me examine you. I examined him, and he was what we say, he had weakness, hemiparesis we would call it,
Okay.
on one side of his leg. His right side of his leg, he couldn't press. He had like a foot drop.
Right.
And the whole leg was weak. So he has something called a neuropathy.
Yes.
So his nerve was affected, and it caused his whole leg to be weak. And he is going to want to drive a taxi. And I said, I'm sorry, you said nothing is wrong with you. This is something chronic. He didn't have this because he has wastage of the muscle. So nerve damage, he got wasting of the muscle, and he got weakness in the leg. I said, how are you going to press the brakes? Now, if I did not examine him, he would have answered all the questions, submit his form, and then fine, somebody else is looking at the form and says, he's okay, send him off. No, he's danger to the public. I said, I'm sorry, you do not qualify for this license.
Risk to life and limb.
Totally, you cannot handle that. And there are other conditions. So what I would say that when it comes to these heavy duty vehicles, that's one aspect to it. Of course, the laws should allow people with certain experience before you get heavy duty license. Like, for instance, you shouldn't get a newcomer. You can't come now learning to drive, because in my opinion, this is just my opinion. I think lots of driving that's happening in Guyana that's causing lots of road accident is inexperienced driving.
Absolutely.
So I can't see sometimes some simple driving skills create an accident. Poor driving skills. So drivers are not experienced enough. They speed too much. You lose control of the vehicle. Now, there's one aspect to it, but the other aspect in terms of the health. So let me just give you some very, very quick examples.
We have a few time. We got a few minutes. We got about 10 minutes more.
Okay. So if you're a diabetes, a couple of things. So you have insulin diabetes and non-insulin. It could be type 1 or type 2, but type 1 is usually insulin, and type 2 can also be insulin, but you get tablets and insulin. When you can't manage it with tablets alone, you can be an insulin. So insulin doesn't define if it's type 1 or type 2. Okay. Insulin means that, yes, all type 1 will have insulin, but some type 2 diabetes can have insulin. If you're on insulin, you have to inform the driving authorities.
Okay.
So, because ever so often, if you go and ask 100 people who are on insulin, have you had a low blood sugar at some point? They'll say yes. Almost all of them at some point.
Right.
We call that hypoglycemia. Hypo mean low, sugar.
Yeah.
What happens to you? You start to sweat. You start to get dizzy. If you're in the middle of the road driving, and especially a big truck, and your sugar drop and you get hypoglycemic, you can kill people.
Yes.
You lose control.
You lose consciousness.
So how many of these drivers and these people on the road do we know if there's a health cause of the accident?
True, very true.
So you should, if you're on insulin, you should always inform the regulatory authority. So we have something called DVLA. So I think we should implement a system like that. I have to establish that you're well controlled on your insulin. You haven't had a low sugar count. Before you drive, within 2 hours, you should have a test done. So your test can be, these finger prick tests, you can have it right away. And if you're driving for long periods, every 2 hours you should be tested, especially heavy duty. But we do that for even type 1 license, which is private vehicle license, because that's very, very important. If you have complications of diabetes, I spoke about before when we talk about diabetes, I talk about diabetes affecting the nerve and the blood vessels. So if your nerves are affected and your eyes and your kidneys. So another thing, if your eyes are affected, I remember before I start wearing glasses, I thought, because your eye vision decreased gradually, sometimes you don't know the difference. And yes, I was driving normally, and I think I'm seeing okay. And then I had my test done because I feel sometimes at night I don't see as clear as. had my glasses, was given glasses. After that, I was like, oh boy.
You didn't realize you were missing, eh?
I didn't know what was missing.
Yes.
Now, that's a fact. So we do for heavy duty as well. You have to have an eye test. You have to reach a certain standard. And we know that people are poor and sometimes you don't have that regular health check done. So you might not know that your eyes are bad, especially night driving, not seeing well. So all these guys and all these things, they should have their eye screening done. Neuropathy, the nerve being affected. If you have diabetes and your nerve being affected. And diabetes is just one condition. I can give you all the conditions. You have epilepsy.
Right.
You have seizures.
Yeah.
A bright light can be a trigger for seizure. I'm driving and there's a bright light flashing in me. I got a seizure in the wheel.
That's right.
What happened?
You go into the truck.
And it's not only, I mean, yes, you endanger your life, but you're endangering the life of others.
Yeah, that's right.
So I'm saying that at some point we have to start thinking along that line. And we have to look at, dissect things and say, fine, we are having too many accidents on the road. Let us look at what can be some of the causes. And I know we do it forensically, like the police will do their job and they will look for police causes.
Right, exactly. Yeah.
Right, so they will do an investigation and say, fine, there's a police cause here. He was speeding or he was under the influence.
Yeah.
Then the vehicle, mechanical causes. You could have the wheel give way, the tire dry out, the your vehicle is not examined properly, a bearing, brake fail, or whatever. So that's a mechanical problem of the defective of the vehicle. But then a medical committee should also look, could there be a medical cause?
Right.
So unless you get all these agencies come together or we form a body, so we should have a body for that I license you, this body, give you the okay that Akash can have a truck license.
Yeah.
You shouldn't just apply and say, I can drive a truck, go for a driving test and you get a truck license. No.
On that same subject of accidents, I want to ask you another question. And this one here has to do for general information and education. We got about 4 minutes more, Doc. And I want to ask you this here. We see a lot of times people get into when there are severe accidents. And bro, I see some people lifting some people out of the vehicle. The one man trying to pull you through the side, so another one trying to pull you pause through this window, twisting. I know that these people are genuinely trying to help because they're thinking like, yo, we gotta get this person to the hospital. But are they doing? I think that they're doing more bad than good, right?
That is true indeed. Because if you have spinal injuries, and I'm trying to move you, I can cause more harm. I sever your nerve. It's damage for life. So these are important things. So when you have, but it's a difficult one because you got to look at an environment where if I'm going to have an emergency response team can respond in few minutes.
Right.
So you can't have an ambulance, call an ambulance, and the ambulance take half an hour to reach the scene. So of course we can have different locations, and I think Ghana will get there. I mean, slowly we would have emergency points where you have an ambulance with a crew there, at different intervals. So I can't have somewhere in the mid Mahika, for instance, and an ambulance from Georgetown got to go down. There you should have a point. Likewise, along the highways. So in those accidents along major motorways, highways, we should have emergency response crew. We could also have a system where we train community volunteers, where they're trained in first aid. So some basic first aid knowledge is important. We can train people, and then so you have the emergency response training. And another thing, maybe what we need to look at, the ambulance service. I've seen ambulance making accidents, and the problem is there is one thing racing toward the scene. There's another thing racing back to the hospital. There are couple of things to that. I'm not there just to transport you. An ambulance is not there just to transport you.
It's
to provide service.
Yes.
So when an ambulance arrives at the scene, if I call for the ambulance and a man come in with get a heart attack, his priority is not rushing him in 5 minutes to the hospital. I start treating him there.
Care until he gets to the facility.
I can shock him there. I can intubate him there. I can, breathe for him there. Right? I don't have to race back and be, because still I'll be delaying the process. I take half an hour to reach, half an hour to go back to the point. 1 hour done. Your patient, every minute make a difference. So what I'm saying is that we have to aim for these higher level of care, and some basic things we can get in place, and then let it build from that. So you have good response, you have good what do we call force aid at the point, train people how to handle, how to stabilize the spine, how to transfer you onto a spinal board, for instance, so you don't lift the hand and the foot and they're crunched up like
exactly,
that.
exactly.
So I can turn you, put you on a board, a spinal board we call it, position you, transfer you to a vehicle. You can do all of that if the response team is taking a longer time. But if I know, hey, I've called the ambulance and I know you're going to be here in 5 minutes, they will tell me, they'll talk me through what's going on. Is patient breathing?
Exactly,
can they feel? Can they talk? You know, so you know, so are they gushing of blood somewhere? Can we put a compression bandage? These are simple things we need to get right.
All right. So we're out of time, but here I want to share with you. I think I laughed just now. On the same platform, I remember somebody calling on the critic. You know, this is TBN Studios we were here at, calling and said that he was in an accident. The ambulance went to pick him up, right? And when the ambulance is coming back, the ambulance get in an accident. There's not a man who get in the accident with the ambulance. He drive in, or the ambulance now, the sick man who he foot broken, that kind of thing. When the ambulance crash, he nose break again. There's not all the ambulance man now. The man talking on this on critic program. He called and he said that the ambulance now decided to chase the man who get anything. He did in the back, they're shaking up, and this man that walk in the street chasing his car who will get an accident. So I mean, this might be funny, but
no, of course, but it's not funny when life is life is involved.
This man said both feet break, and now he did this thing going to town. And this ambulance get an accident. Now the ambulance man chasing the other man, and he bouncing up inside.
So it just goes to show also, is a training there for that person. The ambulance driver should say, what is my priority? My priority is to get this patient to the closest point safely. And yes, you may have an accident. Afterwards the police will deal and find him. And we should, I think, eventually it'll happen. But my attitude should not be that, I need to chase him and create more harm to this person. So
I've seen several accidents in
but these are the kind of attitudinal things and things that we have to change. I think with time, sensitizing the public, talking, having open discussions. And we don't want to be overly critical.
No, we don't want to be.
Sometimes people get a sense that you're here just to criticize. No, I'm here to also say we've come a far way.
Right.
We've gone on the days. We have an ambulance service. Things are improving. Mm-hmm. We have people are trained to do these things, but also we need to change their people attitude. We need to and aim for the stars.
That's right. More professionalism, right?
That's correct.
Yeah, we got to be more responsible in our approach to things,
and people got to be accountable for things.
Yeah, man. I think
at every level.
But what I can tell you, man, is that what I've seen, we've had these new hospitals, 6 new regional hospitals. I think that healthcare in Guyana, I would say, is very good. I don't go to no private clinic.
Yes.
I go to the public clinics, and I can say that it's very good, and I believe that it will improve more. And we can't wait to have you back home here permanently, so that you can lend your support and your expertise and your experience in these very, very invaluable places. Because health. There is no price on health.
Definitely.
Doc, thanks again.
I think by doing this, making a contribution here as well, creating awareness and having this discussion, I think that's an important thing.
Right. We're not here. Right. We're not here to criticize anyone. We're just here to bring these subject to the table and see how best things can become better.
By sharing ideas and talking through things, we can improve things.
And to your healthcare workers out there and all the ambulance drivers, we love you, man. Go do your job. Yeah, you guys are, you guys rock. You're the real OGs, the real heroes of this country
of course,
and this world, right? So on that note, you have a good one from me. What would you like to say, Doc?
Likewise, echo the same sentiments, and I'm happy again to be in studio, and hopefully we'll continue these discussions, further.
All right. So
thank you and good night.
So remember to stay safe, be healthy, and we're going to see you here again next week at 8 on Tuesday. All right. Have a good night, everybody.
Thank you. Good night.